You're good.
Okay, I call the meeting to order. We have a quorum. Ms. Hackathorn, could you call the roll, please?
Yes, Dr. Moore,
Present?
Dr. Robinette. Here. Dr. DeGuzman, Ms. DeWitt. Here. Mr. Adamson.
Here.
Mr. Griffith,
Here.
Ms. Johnson.
Okay, so we have a quorum, so we can do some business today. All right, our next order of business is to adopt the agenda. Is there any modifications to the agenda? Okay, can I have a motion and a second to adopt the agenda?
So moved. Second.
Okay, and all in favor, say aye.
Aye.
All opposed, same sign. Okay, that motion has carried. Okay, we're going to talk about the last minute meeting minutes. On November the 20th, 2025, everybody had a chance to look those over. Are there any additions? Modifications? Okay, can I have a motion and a second to adopt the minutes?
So moved. Second.
Okay, any discussion? We'll have a vote. Okay, all in favor, say aye.
Aye.
All opposed, same sign. Okay, that motion carries. Public comments. We're not at the public comment period, so we're just gonna go ahead and move on past that. Any old business? Well, Ms. Zibby.
Thank you. So as you recall, last month we tabled the 170 Davis Avenue sewage variance, which is, if approved, would allow a component of the septic system to be installed closer than 10 feet to the property line, the house, and a utility line. The minimum isolation distance in code is 10 feet. The owner is requesting approval of a household sewage treatment rules variance, allowing a portion of the septic system to be installed closer than 10 feet to the property line, the structure and utility line, with the property owner signing a hold harmless agreement. I went back to the designer of this one, if you remember. It's a discharging system, and we're putting in a absorption trench to try and absorb some of the water prior to it hitting the ditch that is not really existent in this area. He went back out to do on site to double check to make sure he wasn't missing anything. And he said, unfortunately, he can't find enough suitable area for a soil-based sewage treatment system. The front yard has a buried gas and water line. The backyard has a buried pool with fill material and compacted unsuitable soil due to a large tree that was removed earlier this year. And so there's really absolutely no other option for a system at this property besides the discharging system with a trench coming down the side of the property.
And so after you thoroughly investigate, you're agreeable with, okay, it's an option, okay.
I know Chris and I talked with a gas line being there, that when they go to do the install and have that gas line marked to see exactly where it is, it may be a better option for them to go across the back of the house and come on the east side, yeah, and doing it that direction so they don't have to deal with the gas line. But we'll see exactly where it's located once they call in the utility markings and kind of let the septic installer decide if he is comfortable being that close to the gas line.
So approval of this variance would actually cover both of those scenarios, because on the other side, they'd be less than 10 feet from that side of the property line. So this variance would cover both options, but we do want to rely on the installer to make the best decision, thinking about the utility line that's there too. So
Okay,
that's where we're at.
all right, so we're asking for a motion and a second approving the sewage variance at 170 Davis Avenue in Ohio.
So move.
Second. All right, any questions? Ms. Hackathorn?
Mr. Adamson,
Yes.
Ms. DeWitt. Yes. Dr. Moore,
Yes.
Mr. Griffith,
Yes.
Dr. Robinette.
Yes.
Okay.
It's me again.
Yes.
All right, so this is a sewage variance at 60 Skyline Drive. And if approved, it would allow the leach lines to be closer than 10 feet to the driveway. This one is a post installation variance. When the installer went out to install, he found that the driveway, I don't know if the driveway kind of moved or if it was wider than they had initially planned, but it's 9 feet. The end of the trench is 9 feet from the driveway, and they couldn't shift up due to lot limitations and the presence of bedrock. So the code requires a 10-foot isolation distance from a septic system component to the driveway. So the property owner is requesting the approval of the variance allowing the leach line to be closer than 10 feet to the driveway, with the property owner signing a hold harmless agreement.
So did I hear you say that the driveway moved?
So when they design the septic system, like they have it planned out, but then once the construction company comes in and starts doing things, they don't always pay attention to our
Oh,
septic
okay.
flags and things like that. So I think what happened is they built the driveway wider than what was on the sewage plans.
Mhm. Okay.
Yeah.
All right. Okay.
We also talked about making a recommendation to the homeowner to put some kind of a barrier or something at the edge of that driveway, even like a curved area to keep a car
People
from
from going
driving.
over.
Yeah, because we don't want a car driving over top of their leach lines, they'll
Mhm.
crush it, and because it's at the turns of some of these lines, they could affect the entire line all the way down. So we didn't feel strongly enough that it needed to be a requirement, just a recommendation to the homeowner to do that.
All right, so we're asking for a motion and a second approving variance at 60 Skyline Drive in Inman, Ohio.
So moved.
Second.
Okay, any other questions? Ms. Hackathorn?
Dr. Moore,
Yes.
Mr. Adamson,
Yes.
Dr. Robinette,
Yes.
Mr. Griffith,
Yes.
Ms. DeWitt.
Yes.
Zippy?
All right, so the next two, 609 Garen Drive and 210 Meadow Lane are both aerator discharging systems. So 609 Garen, we went out initially the beginning of November, and it was found that the system did not have a functioning motor. The property owner actually called last week and stated that a service provider was coming out to look at it in the next week or so to see what needs to be done, but we're still requesting that you guys declare it a public health nuisance for no motor. Do you want me to do both of them at the same time?
Yes.
210 Meadow Lane is also a discharging aerator septic system. Our initial inspection was the end of October, and it was found to not have chlorine, and as of yesterday, it still had no chlorine. So we're asking you to declare that property a public health nuisance as well.
Okay. So the one needs some motor work, and the other one needs chlorine tablets.
Yes.
Can I get a motion and second to declare these properties public nuisance?
So moved. Second.
Any questions? Ms. Hackathorn?
Dr. Moore,
Yes.
Mr. Adamson,
Yes.
Dr. Robinette,
Yes.
Ms. DeWitt,
Yes.
Mr. Griffith.
Yes.
All right,
I
I'm up
take
again.
my eyes off of you.
I'm gonna get all mine done at the beginning. So I can sit the rest of the time. All right, the next three are Class 2 composting facilities and construction and demolition debris license renewals. So Paygrove and the Northeast Landfill are both requesting approval for their licenses to operate in 2026. If you may recall, the Northeast Landfill is a construction demolition debris landfill that is not open, but he continues to apply for his license, so that way if he needs to, he can open it at any time. Paygrow is a composting facility. Both add significant value to not only to our community and other communities. Both of them are able to be approved, so we're asking you to approve their licenses for 2026. The Springfield landfill is one that last year you guys approved with conditions. Over the course of the year, they've hired a consultant, they've made a lot of progress in working with us, trying to get everything into compliance and where we want it. They have also applied for their license. We took that packet and went to the Ohio EPA and asked for technical guidance on what they had submitted. Things with their applying for a little bit steeper of a slope than what's typical, which can be approved. We just don't have all the technical abilities to review the stability studies and things that are submitted. So we've asked the EPA for help with that, but they are weeks out on getting all the reviews done. So it will be after the start of the new year, once they can get back with us on some technical guidance. That being said, we're asking you to just table that one and not act on their license. However, by doing that, they can still continue to operate under their 2025 license while we work through getting them where they need and all the paperwork and get them approved. So we will bring it back to you once we have the EPA guidance, but we're just asking you to table that one tonight.
Okay, so we're going to address these as two separate issues here. So item number one is a motion and second approving the 2026 license for Paygrow and the Northeast landfill.
So,
Second.
Okay, any questions?
Zippy, do you want the conditions though for the Northeast landfill?
Oh, yes, sorry. I believe
Can
it's,
you read it?
yes.
Provide copies of solid waste disposal receipts to the health department on a quarterly basis.
Okay,
That's the condition of the Northeast landfill.
that's the
Taylor, do
condition.
you have any
Okay,
conditions?
thank you. All right. So now, are there any discussion questions? No. Ms. Hackathorn, roll call.
Ms. DeWitt,
Yes.
Mr. Adamson,
Yes.
Dr. Robinette,
Yes.
Mr. Griffith,
Yes.
Dr. Moore.
Yes. Okay, and that motion is carried, and so we're going to the second one, which is a motion and second tabling the approval of the 2026 license for Springfield landfill pending the additional review by the Ohio EPA and recognizing that the Springfield landfill may continue to operate under their existing license until the board takes further action. Any questions?
We need a motion.
Yeah,
So moved.
Second.
okay. Any additional questions? Nope. Ms. Hackathorn?
Dr. Moore,
Yes.
Mr. Griffith,
Yes.
Dr. Robinette,
Yes.
Mr. Adamson,
Yes.
Ms. DeWitt.
Yes.
Okay. And that motion has carried. Okay.
All right, last one for me. All right, so we are asking for permission to submit and enter the 2026 Water Pollution Control Loan Fund Grant. As you may recall, this is money that helps homeowners repair or replace their failing septic system. We have been applying for and receiving funds since 2017, and we have received probably close to $1.5 million. We've been able to repair or replace 81 septic systems in that time period, and we are extremely grateful for the opportunity to be able to apply for and be granted funding through this program, as it is a great benefit to our community.
Okay, so I'm asking for a motion and a second authorizing the health commissioner to do all things necessary, including submitting the grant application for these funds.
So moved. Second.
All right, let's see here. Any questions?
Was this already completed? Because it says date grant application is due September 22nd, 2025.
Yeah, so we had to put in a nomination form to say that we were interested.
Oh.
And how much is the grant?
We asked for the maximum, which is $150,000.
Any additional questions? Okay. Ms. Hackathorn?
Ms. DeWitt,
Yes.
Mr. Adamson,
Yes.
Dr. Moore,
Yes.
Mr. Griffith,
Yes.
Dr. Robinette.
Yes.
Okay. Position upgrade.
Thank you. I'd like the board to consider moving Rose Westner, who works in Help Me Grow, from a community health worker 1 to a 2. She's been with us for a little over a year. She speaks Haitian Creole. She is great with her families, and she's completed the training to be a certified home visitor with the Department of Children and Youth. So I'd like the board to consider moving her up.
Wonderful. We're asking for a motion and a second to approve the position upgrade for Rose Westner.
So moved.
Second?
Any questions? Ms. Hackathorn?
Mr. Adamson,
Yes.
Dr. Robinette,
Yes.
Mr. Griffith,
Yes.
Ms. DeWitt,
Yes.
Dr. Moore.
Yes. Okay, motion carries.
Thank you.
Employee Service Recognition and Appreciation Policy, Mr. Cook.
Well, in your package, you have a revised appreciation policy. The first policy that we had here was created back in 2017, hasn't been touched for a minute.
I
So-
love the fact that you have the last review dates and then a continuation in 2027.
Yeah.
That's,
Yeah, actually, the core team is being very intentional going forward about our policies and not going, hey, we haven't reviewed that for a decade. So we're putting everything into kind of an index, and everything's going to be reviewed on a very timely basis. So this will be one of those. You can see the date of a couple years here to take a look at this again. And so this is a revamp, and it's pretty significant. And so with procedural policies, typically they don't have to come to the board, but this one's coming to you because this involves some money now. Because prior to this, it was a certificate, thank you for your 5 years, 10 years, 15, 20, 30. But we wanted to beef it up a little bit and show our appreciation in a little different way for our employees. So you can see there is the different stages of recognition, again, on the 5s, every 5 years. But this is, some, companies, private industries have a book. You've reached your 10-year milestone, you can order something out of this book. Well, our book is a page and a half long. So, all right, we're government. So we wanted to be responsible, of course, to the taxpayers, but also recognize that government employees deserve this kind of recognition too. And they really do deserve it. So this is just a little way that we can do that. You can see this is kind of, you get a choice of these bulleted lists. I'm just going to look at the 10 years. If you reach 10 years of service from us, with us, you can pick 2 extra 15-minute wellness breaks, 2 bonus casual days where you get to wear jeans without a logo, a service pin, a coin, which I think people are making fun of me for secretly because I think those challenge coins are cool. And I think that's the only reason that's in the policy now. A public health lanyard or a badge reel, it's got our logo on it, credit towards buying some logo clothing, and then or another 60 minutes of personal leave. So again, I believe this is the marriage of being responsible as a government entity, but also saying we value you to our employees. Hopefully you see it that way as well. Just appreciate the Workforce Development Committee working on this and bringing it to the core team. Had some good discussion, and hopefully you all think this is a good idea too. Questions?
Do I get every item under that bullet or I get to select?
One.
One.
You select one.
Okay, all right. Okay, have a motion and a second to approve the changes to the employee service recognition and appreciation policy as presented.
So moved. Second.
Okay. Any other questions other than I wanted more than one item? Okay. All right, Ms. Hackathorn, vote.
Mr. Griffith,
Yes.
Mr. Adamson,
Yes.
Dr. Robinette,
Yes.
Ms. DeWitt,
yes.
Dr. Moore.
Yes, okay. Cyber security incident reporting policy, Mr. Cook.
It seems like every week you're hearing about a different municipality, a city, that's got malware hacked or ransomware or things like that. So here in Ohio, House Bill 96 codified some requirements for local municipalities. We are one of those independent subdivisions that this would apply to, but in House Bill 96, there was a couple of different things that we're required to do. This is kind of the first phase, part 1 of 2. This is our cybersecurity incident reporting policy that we have to adopt to be in alignment with the Ohio Revised Code now. It's not very long, right? It's 3 pages long. It outlines some of the things about what we have to do, how quickly we have to respond and report an incident of a breach in cybersecurity. And so this is, like I said, it's part 1. Part 2 is going to get a little more extensive, and that has to be done by mid-year next year. I would say we're pretty lucky because Tech Advisors, who's our managed service provider, a lot of their clients are municipalities, cities, counties, and they are right on this. They wrote this for us. I made a couple little tweaks here and there just to make sure it fit what we do as a health department, but they're on the front lines of this, and they pretty much have the second phase of it ready for us to adopt next year. So we will be coming next year with a second piece of this policy, but this is the piece we had to do before the end of the year. Happy to entertain any questions.
Okay, we're asking for a motion and a second approving the cybersecurity incident reporting policy as presented.
So, second.
Okay, any questions? Ms. Hackathorn?
Mr. Adamson,
Yes.
Dr. Moore,
Yes.
Ms. DeWitt,
Yes.
Mr. Griffith,
Yes.
Dr. Robinette.
Yes.
Strategic Plan 2026 to 2028, Mr. Cook.
Well, it's been a minute since we've had a updated strategic plan. Our last strategic plan spanned the years 2018 to 2020. And then we had this thing that happened worldwide that had us pause and focus on some other things. But it's time to once again have a strategic plan. This is a living document. I already want to revise it. I don't know if any of you noticed, but apparently we need to have a portion of our strategic plan that teaches the health commissioner how to use spell check, because on the front page it's spelled strategic wrong, which nobody caught until a few minutes ago, actually. So we will revise that and show Chris how to use Word. So this document, again, truly is supposed to be a living document. There's a lot of stuff in here that you might consider fluff, right? But every word is meaningful in here. Some of this truly exists because of our Public Health Accreditation Board. There are FAB requirements, but I'm not going to walk you through everything, but you see things like letter of introduction, where both Gracie and I have signed this because this will span her leadership here as well. You see the executive summary, acknowledgements, overview of our mission, vision, and values. But the guts really, I'll just kind of direct you to page 10. If you get to page 11, those get into some of the strategies and activities that are going to support our movement in these different focus areas. But if you look at page 10, we kind of have our focus areas and objectives that were selected. So we have 2 focus areas. We wanted to focus internally on some things we need to do here, and we also wanted to focus on the community. I mean, strategic plans should actually focus on both. If you think about in the private industry, a lot of times it is about how do you get more efficient internally, but then how do you serve the customer better? And so we kind of followed that model here with both an internal and external area. So our internal focus area has really 3 different sections to it. First is workforce development, has one objective, and that is to improve workforce retention rates. If you want to see exactly how we're going to do that, you look on page 11, 12, 13, and 14. The second internal focus area is on our culture. And we have 3 objectives as an agency we want to tackle here: improving collaboration and communication across all of our divisions, improving transparency and clarity of our culture here, and then expanding our performance management quality improvement systems. Our third internal focus area is on sustainability, where we want to assess our current and long-term financial health, and then one that is already in motion, ensuring a smooth transition to a new health commissioner over the next year. So that's our internal area. And then we shift to external. We have 2 focus areas for external. First is enhance our community connections through modernizing our community relations and expanding our authentic community engagement. And then the second focus area is expansion and access to our services, where we will evaluate and optimize our agency based on the community needs. So again, very high level, but if you want to take that deeper dive into all the different strategies, that follows on the next 4 or 5 pages. I also want to point out too, at the end of this, how we got to this. You all played a piece of this, the employees played a part of this. On page 22, the appendices, you can see all the inputs. So this plan is the output, the inputs that went into this. As you can see, we're the employee satisfaction survey, and I actually listed all the questions there. The employee strategic planning questions, where I told you we took all of our buildings, we put giant Post-its with 8 questions, and people could anonymously put small Post-its with their responses under those. Then we had about 20 community partners in this room. Gracie and I spent about, 2.5 hours or so with them and asked them these 7 questions that you see here. You as board members were given a series of 8 questions to respond to by email as well. And then finally, on the last page, a couple other inputs, the strategic planning questions for our core team that we pushed through, those 5 questions there. And the other things that went into this was what's called the Public Health WINS, or Workforce Interest Needs Survey. It's a national survey. We got that information from the De Beaumont Foundation. For our staff, that was an input. Our CHA and our CHIP, Community Health Improvement, Assessment and Planning, that went into this. And then we actually took components of our previous strategic plan and aspects of that carried through to this 26 to 28 plan too. So hopefully you had a chance to take a deeper dive into it. We've talked about this with the core team. We've vetted it through our leadership team, and be sharing it with the entire staff as long as you all think it's a good plan for the next 3 years. We wanted to make it a document that wouldn't just sit. I mean, some people write strategic plans that are 50, 60 pages long, and they're just too much, and you don't ever crack them open. We thought, as we worked through this, is use a lot of plain language, a lot of achievable goals, and the activities to achieve those goals are very realistic. So, questions about it?
Okay, we have before you, I'm going to ask for a motion and a second to approve the 2026 to 2028 strategic plan as presented.
So can we make the caveat that any misspelled words can just be corrected without coming back?
Oh,
Yeah,
yeah,
great.
I think that's a great one. And
Thank you.
Steph, did you find other ones?
No,
Okay.
I didn't get my red pen out.
Okay. Just checking. Okay.
So moved.
Second.
Okay, is there any other comments? Ms.
Well, I just want to say I commend you for putting this together. It's been, 5 years since we've had one. I think it's good. These are good. I like the fact that it's short. It also lets everyone on the team know, from, leadership to the lowest, employee that we have, or even us as board members, what direction we're going in and what direction we're facing. So commend you on that.
Yes.
Ms. Hackathorn?
Dr. Moore,
Yes.
Mr. Adamson,
Yes.
Dr. Robinette,
Yes.
Mr. Griffith,
Yes.
Ms. DeWitt.
Yes.
Union County Plumbing Inspection, Mr. Cook.
Well, we just completed our first year using Union County for our plumbing inspection services. We knew there'd be some hiccups, but I will tell you, Zippy would probably echo this. It went smoother than what we thought. She's nodding her head, so I didn't put words in her mouth. Good. I think that's for our staff and for the public and our plumbers. I think there was some angst about this because it was a major change of not having, the contract with Champaign County or having our own plumber. Going with Union County, it's kind of unknown. We were using a new electronic system, but either no one spoke up and squealed about it, or it was actually pretty darn good. And I think it's the latter. So at least for the next year, we're going to stick with the Union County. This is I kind of projected that we'd be with them for at least 2 years before we started reassessing. And so I think after another year, Zippy and I've already talked about mid-year this year, we're going to start looking and see if this is still a good fit. That's not just for us and our staff, but it's for the people utilizing the service, receiving the service. And we'll kind of come up with a plan of action for next year in getting into 2027. But for 26, we're going to keep going with Union County.
Okay. So could I have a motion and a second to approve the Union County plumbing inspection
So moved.
services?
Or second.
Who's second?
I'll second.
Okay, we all second. Okay, I do have a question. So what actually do? They go out there with our plumbers?
Go ahead.
So when any plumbing work is being done, the plumber has to pull a permit to do that work. And then they go in through the online portal and they'll request inspections. And so the plumbing inspector from Union County sets their schedule based on what's being requested that day and goes out and inspects the plumbing work that's been done.
Oh, okay, and we don't have a local guy. Hmm.
However, our plumbing inspector lives here in Clark County. He
Oh,
works in Union County, but he does live here. So he
Oh, that's
Makes it easy.
convenient.
parks his
Okay.
vehicle here and starts his day here.
He
And
probably
actually,
prefers
he
that.
has been busy enough in Clark County that he spends the majority of an entire day,
Oh, this
every
is a
day here in
win-win.
Clark County.
That is so nice. Any other questions? Okay. Ms. Hackathorn?
Mr. Adamson,
Yes.
Ms. DeWitt,
Yes.
Dr. Robinette,
Yes.
Mr. Griffith,
Yes.
Dr. Moore.
Yes. Madison and campaign. Madison and Champaign County Epidemiology Services Contract. Mr. Cook.
So this is money coming in. So we do provide epi services for Champaign and Madison counties. This is, every year I do a cost analysis just to make sure that we're breaking even on this. Both Madison and Champaign want to continue receiving services and support from us. They have to bump their rate up a little bit to make sure that we covered our costs. And we also built into this reimbursement for their mileage when they do on-site days. A lot of their work is done virtually, remotely, but when they do go on-site, we want to recoup that cost. So the amount in here will match exactly what it costs us to provide those services, not making money off another county, but just breaking even. So they continue to be very happy with our services, and it's a good partnership.
Okay.
How are they billed on a quarterly or?
Is it like monthly?
It's monthly.
Based on payrolls, 2 payrolls.
Okay. Okay. So could I have a motion and second approving the Madison County and Champaign County Epidemiology Service contract?
So moved.
Second?
Okay. Any additional questions? Nice glasses. Ms. Hackathorn?
Mr. Griffith,
Yes.
Mr. Adamson,
Yes.
Dr. Moore,
Yes.
Dr. Robinette,
Yes.
Ms. DeWitt.
Yes.
Okay. Motorcycle Ohio grant submission. Ms. Gracie?
Yes, thank you. So you have the grant application summary in your packet. So the Motorcycle Ohio grant is something we've had for many a year, and it's through the Ohio Department of Public Safety. And so it's $42,000. We apply for it every year, and that covers some staff time for both like the administration and organization as like the site coordinator, but it also the biggest chunk of money goes to the instructors that we contract with.
So I'd like to have a motion and a second authorizing the health commissioner to do all things necessary, including submitting the grant application for the Motorcycle Ohio grant.
So moved.
Second.
So how many instructors do we have?
Oh, that's a great question that I don't have a answer right off the top of my head, but it's between 10 to 15.
Okay.
So they each rotate, not one instructor does all, because we have a total of 22 classes throughout the season. They're called seasons. And so they rotate through. And depending on class size, they have to have 2 instructors.
And when do the classes start?
May, and they run May through September.
Is this just additional that people seek out? not associated with the Bureau of Motor Vehicles or anything like that?
Correct. So what happens, so it's through the Ohio Department of Public Safety, and if they go through this class and they successfully pass it, so there's a classroom portion and then a on-site portion, like maneuverability and stuff. And if they successfully pass this class, then they get the endorsement to going to the BMV to get their motorcycle license.
So I can't go and get my motorcycle license just because I've been riding around my,
I mean, you can,
You have to take the
but
test.
yeah, but you have to take the test. If you go through the class, you don't. You get the endorsement automatically.
Oh,
And you get a discount on your insurance.
and you did discount.
Yes,
If you take
so-
class.
I, not here, but yes, I take the
Okay.
class.
Yeah, so, so there is a fee associated with but it, is very small. And, you know, we encourage people because it does go into a lot of the safety, and it's more comprehensive than just going and taking the test, so.
Lori, did you take the class?
I
yet?
did. It was really good. I learned a lot.
Okay, you
Yes.
still riding?
I do.
Okay.
Not very often, and I stay rural, away from everyone else. But yes, it's a lot of fun.
They would maybe I take the class.
My wife and I both took it here
Okay, here,
before I was affiliated with the health department. That's me.
Oh, yeah.
nice, okay. All right, any additional, did we get a move in second? Okay, I'd like to have a motion. And a second.
So
for-
moved.
Second.
Any other questions or discussion? Okay, Ms. Hackathorn.
Ms. DeWitt,
Yes.
Mr. Adamson,
Yes.
Dr. Robinette,
Yes.
Mr. Griffith,
Yes.
Dr. Moore.
Yes. All right, turn the page. All right, staffing changes. Ms. Hackathorn.
Thank you. You can see we just have a resignation and one retirement, who has retired for the second time after a combined service of 37 years. And Zibby will share more about that during her report. And before we go on, we just may need to make a slight change to the resolution to change it to no new hires, just resignations and retirement, sorry.
Okay, so let me see here. No new employees.
It didn't require action to accept anybody that's.
Oh, yeah, so we don't really need a,
We don't.
So we got nothing here?
so we
So this
we are
is for
good.
our information.
Woo, woo, woo. All right. Moving on to financial reports. Okay, Mr. Jim.
Up first is the expenses and the vouchers for the month. That's the 5 or 6 page report. Total for the month is 141,000 and change. Last month, we talked about noodle soup. This month, I don't have anything as exciting. If you peruse through there, the 141,000, the two biggest that I came across, one was 36,000 and a little more. That is our tech advisors that Mr. Cook spoke about a little bit ago. That's our quarterly payment to them. The next biggest one I saw was to a group called Theracom. That's for medicine that we use in our clinics. And the rest
Is
of
that
it
the
is,
vaccines?
they're not so much
No.
vaccines. Are they?
No, I think it's just for RHW.
I think so too.
Reproductive health, sexual health.
Okay, so,
Sorry, I'm happy to discuss any of them if you have any questions, but.
did the font get smaller?
Did the font get
What do you want to hear, Valerie? I mean, I'll tell you, whatever helps you out, good night.
Expenses and vouchers. Can we have a motion in a second approving the expense and vouchers for November, please?
So moved.
Second.
Okay, any discussion? Ms. Hackathorn, roll call, please.
Mr. Adamson,
Yes.
Ms. DeWitt,
Yes.
Mr. Griffith,
Yes.
Dr. Moore,
Yes.
Dr. Robinette.
Yes.
Okay, the motion is carried. Transfers and advances.
This one, we actually have quite a bit of stuff. In your packet that says 3 unbudgeted transfers, there are actually 4. If you look at either the cash basis report or the sheet of many colors on the far right-hand side, as you wander down, you'll see a couple of numbers that show up in red. That's not allowed. So the three that are in your packet, the 89.5 to McVie, the 20,000 to the Safe Communities, and the 4,500 to the Fund for Preconception Health, those get those accounts out of the red for the most part. McVie 8257 is not entirely out of the red. We have a $170,000 payment we are expecting to receive within the next week, which would then get us out of the red. The fourth one is for a whopping $875.01. It would go from our general fund to account 8266. It's our COVID bridge. We were working on exhausting that and thought we had done the right payroll calculation, and then one of our employees got missed on a payroll and wound up getting paid the following week, which put us over budget by $875.01.
875.01?
Yes,
So there's 4 actual.
there are
Plus
4
what you
total.
said. Okay,
Yes, ma'am. 4. And that 875.01 will bring us back to a zero balance in that 8266 account.
so do we need to include that in the unbudgeted sheet?
The resolution just speaks to approving the unbudgeted
Unbudgeted
transfers.
Okay,
So I think you're covered.
all right. So asking for a motion and a second to approve the unbudgeted transfers as presented.
So moved.
Second.
All right, any questions? Ms. Hackathorn?
Mr. Griffith,
Yes.
Mr. Adamson,
Yes.
Dr. Moore,
Yes.
Dr. Robinette,
Yes.
Ms. DeWitt.
Yes.
Okay, monthly funds report?
Sheet of many colors, right? And also a little bit the cash basis report. Last month, I told you what a nice job everyone in this room has been doing to help control some of the expenses in it. I'm a numbers fan, so it helps to put numbers to it for me. If you look at our year-to-date revenue, we're down about 1.5 million from our budget. And I think most of that we can trace back to March of this year. If you look at our year-to-date expenses, we've decreased them by about 3.7 million from our budget. I'm in no way trying to mitigate the horrible decisions that had to be made in March. What I am doing is commending those who made them, because it sets us up well for the future. And one of the groups that's helping with this that I really want to recognize, mid-year, 8212, our early start grant, right, Lori's grant, they changed the way they're billing. And if you have followed that the last couple of months, it has gone from about an ending cash balance of somewhere around $100,000 to almost $550,000. They've done a great job since they changed the billing model, right, with the work they're doing. You deserve it.
Okay, thank you for that update. All right, amended budget approval.
That's still me, isn't it?
That's still you, you're getting to be like Zippy over here.
Thank you.
That's quite a compliment.
So this is a number of pages, right? But basically what happens is, we're gonna talk to you about the new budget in just a minute. We put out a budget, and that's what we think we're going to bring in and send out over the course of the year. And as the year goes along, things change that impact that. And we revise a couple of times or amend the budget a couple of times just to try and bring the budget into better alignment with reality.
So we're asking for a motion and a second approving the final amended budget for 2025 as presented.
So moved. Second.
All right, are there any questions? I'll give you another couple minutes to look at it. Everyone had time to look at? Okay, any questions, discussion? Okay, motion and second?
So moved.
Second?
Okay, Ms. Hackenauer?
Mr. Adamson,
Yes.
Ms. DeWitt,
Yes.
Dr. Moore,
Yes.
Mr. Griffith,
Yes.
Dr. Robinette.
Yes.
Okay. Yes. 2026 initial budget.
There's a whole bunch of names there.
I know.
I'll start.
Mr. Cook,
All right, I'll start.
Gracie, and Jeff,
We're here for support.
please.
Yes. All right, so the format that you received this in should look familiar. It was a change last year, so this is the second time that you've seen this kind of a format. You've got everything, but then you've got some summaries, just depending on how deep of a dive you wanted to take into it. Yeah, this came separate. It's not in there. This
I
came
was gonna say, I
in a
don't
separate
care.
email.
Yeah.
Yeah, it was in a separate email.
Yeah.
But there is one addendum that is underneath your agenda that I'll get to here in a moment. So when I emailed you, it was 40 pages of every fund. You got every fund, every line item. You can see salaries, Medicare, dental insurance, supplies, leases, all that good stuff for all of our funds. But there were a couple of summary pages that I wanted to kind of call your attention to if we had a chance to take a look at that. A couple of these are newer this year, so we have an overall revenue and expense. I can tell you the bottom line. We've projected, like Jeff said, you start out like your personal budget, right? You think this is where we're going to head, and you make some adjustments along the way. So overall, revenue next year, we're projecting at a little over $9.6 million. That excludes transfers and advances, which I believe is the correct way, the most accurate way to represent our true revenues and expenses. Advances are just what they sound like. You send money to a fund for cash flow purposes, and then you bring it back. So it's not really revenue or expense. And then transfers are just what it sounds like. You move from the general fund to support the programs that we get, levy dollars for. And so I always exclude those, but I did, if you wanted to see, including the transfers and advances, just to give you an idea, if you include those transfers and advances that aren't true revenue and expense, I'd be telling you we're going to bring in $11.6 million. But the true way that you can look at this for revenues is a little over 9.6. Going out the door next year is about 10.5. So we are going to, at least initially, it looks like spend more than we're going to be taking in, but we have some balances to spend down. But we also have some work to do. Some of these funds are grant funds that, frankly, we should have spent these grant dollars down by now. Some of it contains, grants from a year or two ago. There are different types of grants. There's base grants, deliverable grants. Deliverable grants are the trend right now. Complete these things and we'll send you this money. As opposed to base grants, things like the WIC grant is a base grant. Say, who do you have? Okay, it costs you that much for those people, we'll give you that much, as opposed to the deliverable base. Deliverable base are still supposed to be spent in that grant year. So for some of our deliverable base grants, like our public health infrastructure grant, we get a lot of those deliverables done in the first 4 or 5 months. So we might have 80% of the deliverable dollars in the first few months. But in that 12-month period, we're supposed to spend those dollars down on that program. There's a few funds where we haven't been able to do that, and we are redoubling our efforts to make sure that we're following best accounting practices. Because we get surveyed, we get audited, we need to make sure that we're doing what we're supposed to be doing in those funds. So there is a spend down on a lot of these funds that you'll see. But I will tell you a couple of things. It definitely underscores our continuing need for some type of levy, whether it's through property taxes or whatever the state legislature blows up and recreates, or we'll see where that plays out. But this underscores for me, we still need that tax revenue that generates over $2 million a year for us. And as you know, we're going to run the renewal levy next fall. And as long as that is still a thing in Ohio, right? Hopeful it is, or something to replace it. But it underscores that need. It also underscores for me that we have work to do. We need to find new revenue streams. So we're going to talk about here a little bit later in my report about one that's potentially coming down the pipe from the feds. And then we also need to continue to decrease expenses, which we've done a heck of a job doing that this year. We still got to keep working on that as we enter next year. What I can tell you, though, is this budget maintains our current staffing levels. It includes a cost of living adjustment for our staff. It does take into account health insurance premiums continuing to go up next year for half the year. So our renewal period is July 1st. And so we have built in the health insurance increase as well. But what this really does for me is in the strategic plan, this is why we put this, we need longer term projections, not just 1 year at a time. You've heard me say this multiple times. We need a 5-year projection and we need a 10-year forecast as well. So Gracie and Jeff and I have already talked about that. We've already made some headway in that area. There's a very complex way that you can do those projections in a very simple way. Very simple way is to say, well, the two biggest things that increase are people, if you do cost of living adjustment, and insurance. Those are the big things. Of course, if you add programs, subtract programs, that has an impact too, but we're going to try to find a way to go kind of in the middle of simple and complex to produce this next strategic planning cycle, 5-year projection and a 10-year projection. We want to make sure that we're setting ourselves up for success to match what the community needs within the bounds of the dollars that we have. So you've got, like I said, every fund taking that deep dive. Hopefully you had a chance to take a look at that. You can see one page, it's got just budgeted transfers and advances. You can see a summary of the forecasted year-end carryovers in the addendum that I gave you. Looks like this, it's under your agenda. Just kind of gives you an accounting classification of those carryover dollars where I think we're going to exit next year with just over $3 million. You can see what the difference is, those restricted, committed, or assigned or unassigned funds. Restricted carryover grant funds are their constraints by a grantor or law. Committed dollars are things that we as a board or Gracie or I have said we're contractually and legally obligated to do. Assigned funds are contingency funds, funds that we say, yes, these are assigned to being a contingency if we have an emergency. Then we have assigned program funds, so mostly environmental health funds. We know that we can't spend the license, revenue that we charge restaurants and grocery stores on vaccine clinics. So we have to commit those. They have to be assigned to those programs. And then you see the true unassigned funds, also known as residual funds that don't fit in any of those other classifications. You can see that dollar amount being about $1.6 million. We did estimate the leave liability for going into 2027. You can see we've got some leave liability on the books here of about just under $38,000, but we've projected ahead to 2027, so we're going to need to take that number a little bit higher for 2027 to about $65,000 of dollars that could go out the door if people choose to leave and retire. And then I think I included this too. It's a lot of gray lines on the sheet. You're going to see fewer funds in your reports starting next month, because these are funds that have had no revenue, no expense, and no fund balance, but they continue to appear on the auditor's list. And Jeff was so great to work with the auditor this week to get these removed. So these are things like there's several COVID funds here. Moms and Babies First is an old grant that we used to have. OBI grant, preconception health we had for a minute, and that's no longer used, no balance. So you will see, while we added a few funds, remember we added like nursing and donation and lead, we subtracted away more than we added. So your sheet of many colors, whatever the next iteration of that, will be less. But we are going to get rid of those, I would call them meaningless funds, because there's no balance, no income, no dollars going out. So the take-home messages, I feel good about this budget. I think this week, our final budget meeting with the three of us, we were locked in my office for about 4 hours. I didn't even let the people go out to go to the bathroom. No, I'm kidding. But we really just took a last look at this and make sure that we did the best by the community and our employees in this budget. I feel like the answer is yes, we have done the best here, but not to say it's just, okay, here's the budget, good luck for 2026. We got work to do. New income streams, new ways to cut expenses, but still deliver exceptional service and do right by our employees. That's what this budget's about. So, what did I miss?
I think you did it.
Yeah, I think you did great.
Okay.
And I'm not just saying that.
I already did his evaluations.
Yeah, I knew that was it. I knew that was it.
Questions?
So we have before you, requesting a motion and second to approve the initial budget for 2026.
So moved. Second.
Any questions?
Just, yeah, I did notice that contingency fund went up to 500,000 and, I mean, that makes sense. There's a lot of unknowns here, but 500 wouldn't cover every unknown. And is there a plan?
Scott, the original plan was for that number to be $1 million.
Yeah.
And that didn't hit reality. So at one point in time, a long time ago, I believe it was about $500,000. The last few years, it's been $250,000. We had to tap into that, was that 2 years ago? 2 years ago, to pay off some things, and then just getting it back to where it should be. I mean, that's not even a month well, it's not even a month of operating expenses. You can do the budget, $9.5 million divided by 12, it's more than 500,000. But that's where we are right now. We'd like it to be higher, but truly those are dollars. There's a lot of reasons. The first one that frankly comes from this year, it would buy us time. So we get grants that are cut from under us. It would buy us some time to decide, okay, what moves do we need to make and be smart about it. It would allow us to pay people for a little longer or handle unemployment, things like that. A variety of contingencies, but just this last year, that's still at the top of my list if something gets pulled out from under us, it buys us time to make smart decisions.
Okay.
So I know it's 500,000, but you also have 1.6 million in unassigned funds.
Part of that 500 is in that. It is unassigned. It's contingency. Wait, let me double check. No, it's not.
Okay,
It's not. I'm sorry. That is assigned contingency fund. So there's 1.6 that is unassigned,
right.
and then the 500,000 is assigned contingency.
Okay, all right. So I'm like, so if in the case that there is something
Sure.
really, really bad that happens and there won't be, then we still have this 1.6 where theoretically we could pull from.
Theoretically.
Okay.
As you, that number floats at the end of the year because we walk into January 1st and there's a lot of grants we don't have. So a lot of that is used for cash flow.
Mhm.
The main reason we didn't make that $1 million is we felt we needed 1.6 in there for advances, transfers. I mean, you see what's going out the door. We cannot make all of our advances and transfers out of that money. Our total amount of advances and transfers, I think, is just above 1.7 million.
Mhm.
So if we took that down closer to $1 million, put that $1 million in contingency, left $1 million as unassigned in the general fund, that wouldn't cover the dollars to have to go out to support the different programs.
So even though it says unassigned, we really do think that that's going to be for transfers and okay.
For sure.
Because pre-COVID, it was 400,000.
Was that what it was? I knew it was close to 5. Thank you.
400,000. So this really is more than what we even had 5-6 years ago.
Yeah.
So,
It's a good place to be.
Yeah.
Okay, so do we have any other discussion? Okay,
There was a motion and second.
okay, yeah. So can we have the vote, please, Ms. Agatha?
Yes, Mr. Griffith,
Yes.
Mr. Adamson,
Yes.
Dr. Moore,
Yes.
Dr. Robinette,
Yes.
Ms. DeWitt.
yes.
Okay. Okay, public health team reports. Cindy?
All right, so as Shannon mentioned earlier, we have one retirement in environmental health. Tuesday, December 23rd is Rita Lewis's last day with us. She has been with the health department a couple of times. She has been here and left and then came back and then retired 2 or 3 years ago and is officially retiring now after about 37 years combined of service. Rita has been very instrumental in many of our programs and will be missed by many, not just internally, but externally as well, with a lot of our clients and things like that. She's built a great relationship with a bunch of those. And so we just want to wish Rita well in her retirement. And hopefully she can enjoy that time after the many years she has dedicated to public health. Besides that, I just want to say how appreciative I am of all my staff. Things have been a little crazy in environmental recently and busy, and we've had a lot of changes, and everyone has just picked up, done extra, and has they've just really gotten out there and helped each other out and have been great team players. So I really appreciate all that they have done and stepped up. So,
So, Rita, thank you.
I sure will.
Yes. 37 years.
Yes.
Wow. Okay, Ms. Taylor, nursing and clinics.
I'm just going to piggyback off of Zibby here. I just want to take the time to acknowledge and thank my staff. 2025 was not an easy year for nursing or really public health in general, I think. There were a ton of challenges, a ton of changes, myself being one of them. That's a huge change for the staff, and they've been amazing, and they just continue to rise up to what we need them. So I really just want to give them some acknowledgement and thanks.
I hope this is recorded so they can hear all that. Okay. Any questions, discussion? Ms. Lambert.
Thank you. I can echo also because the billing has increased so because of the home visitors doing such a great job. So it's all of them really. And speaking of that, so our wait list is down to 26, so it's the best it's been in a couple of years. So that's trending in the right direction. So that's good. We did get notice yesterday for our Cribs for Kids though that our pack and plays are stuck in customs and aren't going to be able to come into the United States. So I guess it's impacting 6 counties in Ohio so far, and we just happen to be one of the 6 because we put in order kind of late in the year, I guess. So that's unfortunate. I only have 5. So I've been trying to work with the hospital a little bit to see if they want the 5 or if we keep the 5 and they send the people over. So we'll kind of work on that one. And then the last thing I wanted to bring to the board's attention is the Edward Jones office of Sarah Clemens did a fundraiser type of, she asked her clients if they would want to bring gifts for Help Me Grow families, and they were very generous, and a lot of people did, and so our home visitors have been busy getting those gifts out to the families that are on their caseload that have the highest need. So that's been a great collaboration in the last couple of weeks. That's all I have to say.
Is
We
there
appreciate that.
any comparable product to the pack and play?
There are, but we don't have the funds for it. We can't pull the funds. I mean,
That you've already
they have a
put, yeah.
contract with Department of Children and Youth, so we would have to have the funds to, but we could go directly to Walmart. So I was gonna kind of see how it falls out, so. They don't know how long it'll be. They hope it'll be in January that they'll be able to come in, but I'm not sure.
I know people rely on those, so.
Yeah, we kind of have the infrastructure built so that
So how many do we use a month?
about, this month we had 31. We passed out
Okay.
31.
And does the hospital have any in stock?
No, that, we supply the hospitals.
Okay.
Like this grant
So,
supplies the hospital.
Are you working with Elise Brown?
Yes.
Or Hope
Yes.
Garcia?
Yeah.
Hopefully, we can come up with a plan to
Yeah.
try to,
I just emailed them
Okay.
earlier today, just about that. So,
oh, thank you.
Thank you. Women, infant, and children. Ms. Schaefer.
Thank you. Well, let me first start off with saying thank you to my staff. I don't want to leave them out. I know they've really been trying very hard with our walk-in Wednesdays. It has been a little challenging, and for some reason this week was a little chaotic, but we're working through those revisions to make that better for us and the participants. I do have a note to make regarding the monthly report, a correction to the way minimally breastfed infants are categorized has been made, starting with November's reporting. Previously, minimally breastfed infants were included in participation counts for other infants. So that would be combined with the fully formula-fed infants. And food and nutrition service guidance for participation reporting indicates that infants partially breastfeeding includes infants breastfeeding at any amount who are also receiving any amount of formula from WIC. So this means that infants who are minimally breastfed should be counted in the partially breastfed category, even if they are issued a full formula package. So just taking a look at the report in the infant category, you'll notice the shift in the numbers in partially breastfed infants compared to our non-breastfed infants due to this correction, looking at October and November's numbers. And then I wanted to end on a couple positive notes. First, I mentioned we had a new staff member starting. So she did start with us last week. She's finishing up her second week with us. Abby Stamball is our newest support clerk, and she's been a great addition. She's comes to us with a background as a daycare teacher, giving her experience with kiddos and families. And she's been eager to learn and assist the team as she's able. And we look forward to having her just continue to grow in her new role with us. And then lastly, we've added some color to our clinic thanks to our maintenance team. They've worked over the past week getting new paint on some of our areas. Our lobby, our two main clinic rooms, and our second waiting room have become brighter and more inviting to our visitors. So if you happen to be in our area and over our way, this is your invitation to stop over and check it out.
Yes.
So that's all I have. Thank you.
Thank you.
Health planning.
Hi. Well, I have to thank Steph now. No. I would want to anyway. No, so in the resignations, one was our epidemiologist, Helena. Her last day was last Friday. So I just want to thank her for her service. And then just thank Anna Jean for, we're trying to get someone hired pretty quickly, but she's going to have some slack to pick up for the time being while that person comes up to speed. And then the health planners, as I mentioned last week, there's a new supervisor in Jacob. So that meant a lot of shifting of programs within our current health planner team, and everyone has taken it in stride and are actually excited about new opportunities and new areas they get to work in. So I'm always thankful for when people are excited for changes and, new adventures together. So you have the packet in front of you. I'm happy to answer any questions. There's just one thing I want to highlight. Back in late September, early October, our Jacob, our drug overdose prevention program coordinator, when he was that, got approached by the Ohio Department of Health, and they said, we have an extra Narcan vending machine, and you do great work in Clark County. Do you want it? And we said, yes. Let us figure out where we're going to put it. You don't often get an opportunity to have something given to you for free, and we want to make sure that that resource can be used in Clark County. So Jacob, we had some discussions, and he got to work to look for partners, and the Salvation Army came up. They're doing the warming centers, and I said, let's approach them. Let's see what happens. They were very eager and very excited to have it placed at their facilities. So a couple weeks ago, last week, was it just last week?
Yeah.
I don't know. Time goes fast and slow. Got placed through a partnership with Salvation Army and McKinley Hall. They have the project on grant through the state of Ohio. So that is the Narcan that actually is in the vending machine and got placed. So we're just really excited to have another access point for free Narcan in the community. Our overdose fatalities are trending down, and we want to make sure that continues to happen. And one of those ways is to have Narcan in as many places as possible, not only for people that use drugs, but anybody really. And one of the ways that we're doing that is continuing education and stigma reduction around using Narcan and having it and knowing how to use it. So we will continue to do that work, but we're excited for the opportunity, and we wanted to capitalize on it. So
Thank you.
Is that monitored, that vending machine? Because, what if children get access? Because it looks like if it's free, do they just push a button and it comes out?
yeah, so they push a button. So it's only available when the Salvation Army is open, so people are there. And then we will monitor, like Salvation Army, we have talked to them. When it gets low, then we will fill it and stuff. So yes.
Okay. So when you say is it monitored, is it a place where people actually see? Because how do you know that it's not kids, little kids, I think is what you were concerned about.
Right.
Like, are the buttons really low, or the buttons are up high, or, well, then you got.
It's a normal vending,
Yeah.
it's a normal vending machine, so the buttons are,
Yeah,
the picture's in there, so you can see.
It's a little picture.
yeah.
It's in the gym.
It's in the gym, and when the public is in there, there are always staff members in there or people from Nehemiah, like in the warming center. So there are staff and volunteers, adults who are there. So I don't think the risk for children
Okay.
is, I mean, there is a risk.
Right.
that My grandkids would go up and press the buttons. Yeah, that's the risk, but there are adequate supervision, I would say.
Okay. That's very nice. Oh, I did have a question related to the epidemiology person. We're hiring one?
Yes,
Okay.
yeah, so we're in the process of interviewing right now.
Okay, okay. Thank you very much.
Yep.
All right, health commissioners, legislative updates.
All right, we'll start with legislation. It was kind of quiet this last month, so to speak, except for the continued, mystery that what is property taxes going to look like in Ohio in the future. But I'll just draw your attention to a couple of different bills. First one was actually one that I was assigned on behalf of AOHC to take a look at, House Bill 609, that requires public bodies such as health departments, boards of health, to allow public comments before taking any action at all. So, we have a public comment period here designated on our agenda. It's not required, but it's good, right? We need to do this for the community, give them a voice. But this would change public bodies to open up to the public, to the floor, before taking any action. So everything that you took an action on tonight, every motion you made, when you say, are there questions, you would have to give the floor potentially to the public. It's pretty wide open right now. I think this is actually a result of some things that happened up in the Akron area where some legislative bodies up there at the city level basically shut down comments when they had a public hearing. This is not, I think this is not the way to fix one little problem, but we'll see where this goes. I've never had any problem with public input, but after every action, after every motion that you make to adopt a policy about employee recognition, to accept the bills, I mean, it seems like it would be a bit excessive, but because we do have on our agenda a portion for public comment, and we do have a time, if we have a public hearing that's changing fees, we had a public hearing this year for the fees that we changed in environmental health. Those are the appropriate times to do that. And we all may, all municipalities and entities may feel the impact of some bad players in one little place in Ohio. So we'll see where that goes. Again, that's House Bill 609. Also want to call your attention to House Bill 587 in the companion bill in the Senate, which is 299. You ever heard of kratom? You know what I mean when I say kratom? Okay. So kratom is a tropical tree that's found in Asia. It is classified in the United States as an FDA unregulated herb, herbal supplement. The problem is it has, taken in the right doses in the right form, it has opioid-like impacts. And so it is not regulated. Again, it's an herbal supplement. Ohio is taking some steps to regulate it as they should. So AOHC is in a position to support this House bill and the Senate bill. But if you've never heard of it, just want to Google search for kratom, 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 kratom products that will regulate the sales, production, warehousing of those products here in Ohio. So yeah, Google search for that. Learn about that. It's here. So those are the two things I wanted to bring your attention to. Again, I have nothing really that new to talk about with property taxes. I'm not sure what else to say about it. What did I say?
Oh, no.
Oh, okay. I'm like,
Sidebar.
okay. Krypton, I thought maybe someone mistook that. All right. A couple other things I want to mention. I mentioned earlier, we were talking about the 2026 budget, things we need to do, decrease expenses, increase revenue. One of the potential places that we'll be able to have an impact there is something called the Rural Health Transformation Program. So this is an investment of $50 billion by Congress that was made this past summer to strengthen healthcare access across rural America. It is really designed to do that, collaborative partnerships, new ways, and again, focusing on rural America to make high-quality healthcare more available. There are lots of different goals in here. Ohio put forth an application for these funds. Again, $50 billion available. There's a lot of talk about this, about local health departments, federally qualified health centers being sub-grantees of this. It remains to be seen whether or not Ohio gets awarded based on their application for these dollars. But there was about 7 focus areas for Ohio's application. First, it's just pure access, having more points of access in rural Ohio for not only pharmacies, behavioral health specialists, family physicians, so an investment there. How are they doing that? Rural healthcare workforce pipeline. So partnerships with educational institutions, recruiting, training, making it financially interesting for new doctors to serve in rural Ohio. You can connect the dots there. Technology services for improvement in EMS. And I think about some of the things that we have potentially here, community paramedicine, there might be a play in there to get some financial support as well. So they want to increase outcomes from those EMS interactions. They also put forth an application to focus on chronic disease, promoting healthy behaviors, everything that we do here as a health department. School-based health centers was another focus of the application for Ohio as well. Vision care was in this as well, the Ohio Seed program, which is something that we've dabbled in here in Clark County. Reducing infant mortality rates, and then data and IT infrastructure. Those are all components of Ohio's application to the feds for this Rural Health Transformation Grant Program. There's a bidder's call for locals that'll be happening just after the first of the year on January 6th. Gracie and I are right in on it. We're putting our ear to this and looking for opportunities that we can serve Clark County. If it's not the health department, we want to make sure the right entity in this community gets it. If it's Rocking Horse or the hospital or something else, we're right there. We're right in there with the Ohio Department of Health to see if this is something that'll help us here in our community. So there's that. Also want to talk very briefly about, so at our last Workforce Development Day, we had a presentation to the whole staff on something called Care Portal. Has anybody heard of Care Portal? All right, so Nehemiah Foundation is the implementing partner here in Clark County for Care Portal. It is a national, really it's a care sharing technology is how they bill it. So there's 2 components of it. Entities can submit needs on behalf of people that they're serving in the community. And then there's the other side of it where you fulfill the needs. And so there's over 30 churches here in our community. There's a handful of businesses and some other agencies that are on that side of filling needs. If you are a submitting agency, if you're dealing with a family, a child that's got some needs, maybe they said their number 1 thing is a request for beds in our community. And so you're serving somebody, and maybe one of Lori's home visitors is out there and someone needs a bed, no kid should be sleeping on the ground. If we were a submitting agency, could submit that need, and then one of the churches or agencies then fulfills that needs and directly interacts and serves that need. From a coordination and efficiency standpoint, it's phenomenal. So we took it a step further. We took a deeper dive with our leadership team here just this week and said, hey, what would it look like if we were one of those submitting agencies, identifying those needs so that the churches could help? There was not a bad thing about it. I mean, sometimes you think there might be something like, oh, that might not work out. I mean, we all went out the door saying, we really need this. We interact with people that have those needs and we can get them filled. I will tell you there is a cost to this. I've estimated the cost at about $6,000 per year to be one of those submitting agencies. So Gracie and I are going to look for a funder. We're going to look for a funder either locally or the state that would help us get there, because I really want to bring this to our staff. I really want us to be able to provide those wraparound services. There's a price tag. It's pretty, I mean, $6,000 to have access to the system for some of the things that we can do in wraparound services for our families and kids that we serve. I think in a lot of ways could be a bargain, but we need to find somebody to help support us getting into that. So we're going to look for funding and see if we can get that done here in 2026. Incredible report. You can just search for Care Portal. I think
Is that a one-time fee or is that?
It's annual.
Annual?
Yeah. Yeah. So, and you might even be a part of a church that maybe is in the Care Portal. There's quite a few. And I think we could do some really good things for our community. Actually, I'll save that for next month since It's 20 after 7. I want to say that the staff participated in a fun but educational thing where we challenged all of our different departments to make safety videos. So we took all of our safety policies here at the health department, things like suspicious package, fire, earthquake, things like that. And we challenged our different divisions to make an educational video, but funny. And we showed all the videos at our all staff meeting on Friday. It was amazing. I can't even, we thought about putting one up on the screen. We might do that for you next month. But they were great. I mean, just all across the board, people were laughing. People enjoyed doing this, but they're educational and we're going to use them for like new staff. So they were, I don't know. Cheyenne, I'm looking at you. I know. So
Harrison was robbed. If you're,
oh my God. Okay, now I'm gonna flex and say administration won. So, but you guys, you had, so they did suspicious package and it may or may not have included the song Can't Touch This, right? So
and
it
our
was,
amazing employee Bernadette Kidd.
It's great.
I think we might have to show that next month. I think that's the one we're gonna have to show. But they had a great time and we all enjoyed seeing it.
Bless you.
So that was fantastic. As we enter 2026, I just kind of echo the comments that have been said. Y'all are great. You make public health go round in this community for our families. The staff do the same thing. I've been very honored, and I know Gracie would feel the same way, to be fortunate to leading this organization. As we enter 2026, it's going to be filled with some changes here at that leadership level, but I've had complete confidence in this transition and thankfulness to all of you for understanding the need for this. I've never been so sure of your next health commissioner than I am sitting right before you today. And I'm excited to see where Gracie's going to take us as we start that transition here in the next month. So, so speaking of other leadership things, Mike, I'm going to mention that you know that you have been serving on the board and your term is coming up in January. I appreciate you agreeing to stay on again. The city of Springfield has agreed that they would love to reappoint him. So Mike will be reappointed by the city of Springfield before our next board meeting. I just wanted to mention that. So get used to his mug being on the board for another few years here. So, but that's it. I appreciate your confidence in everybody sitting on this side of the room.
Time for questions?
Sure.
Okay. So in this rural health, Ohio, $50 billion, and I appreciate that they're looking for healthcare providers, but I did not hear anything about dental.
That proposal is not in Ohio's application. I don't know if that means they decided not to put it in there or it didn't fit one of the grant categories. I don't know the answer to that. I can find out for you.
Oh,
But
that would be
Ohio-
wonderful. Since
Yeah,
that is
Ohio,
like-
every state gets to put an application and we didn't have any input on that, but
Okay,
I don't know if that was even a category that they could put in
okay.
an area for. So
Okay.
I'll be happy to find out for you.
Thank you. That would be wonderful, because I'm like, that is like entryway into our health. So thank you very much about that. And then my second question is, I was looking at the vital statistics, and I don't recall seeing Haitian births and Hispanic births in the past. So I see that it's filled in, but I was like, I don't really recall, and maybe I was just swiping too fast in the past.
We just started that,
Okay,
probably.
This year.
It was this year, I think it was March.
March.
Mhm.
I think it was March, and so we were able to go back for Haitian births, and then we just started the Hispanic. In July, we couldn't find the data to go back, we started tracking.
Mhm.
And so we started that because for some other reports we were looking at, and we needed it, so we thought it was a good addition. So we decided to just add both of those to the monthly report, and so we started tracking that, like I said, in
Oh.
March.
So that was an internal,
We were getting
We want
requests
to-
for this
Yes.
data pretty regularly. The governor's office was asking for it, so we just decided
Yes.
to put it in here for you too.
Yes.
okay. Okay, those were the only two questions I have. It's been a great year. I have enjoyed myself immensely. I want to say thank you for all the work that you do for our community. It makes a difference, and we do appreciate that. I also want to thank you for the colors coding. Okay, this makes my life so much easier. I will also say that since I took over as president this year, we have never got out on time. Okay, I don't know if anybody else has noticed that, but I certainly have. Okay, so I'm hoping for next year to be much better in that regards. And I want to say Merry Christmas, Happy Hanukkah, Happy Kwanzaa, all the other holidays that are coming, and have a great holiday season. Okay, all right. And are there any other comments before I say this day is done? Oh, wait a minute. Executive session? No. Okay. Hold on, I gotta find my papers. Any additional business? No. Next regular business meeting is gonna be on January 15, 2016. Okay, here, same location. Yeah, same, right here. And now we are,
Got a time travel.
now I need a motion and a second to adjourn the meeting.
So moved.
Second.
Okay, voice vote, all in favor, say aye.
Aye.
All opposed, aye. No. Okay, motion carries,
We're out.
okay.
Thank you.